All right, welcome. Welcome to Module 1 of the Parkinson's Regeneration Training Online Institute. I call it neuropsychomotor rehabilitation because we have neuropsychomotor involved. We'll learn about that as we go through. How I look at it is an integrative and fitness-based approach to improving movement, memory, and cognition. All right. I have a couple of books out. We can talk about those later. Right now, let's get down to it. This is Module 1. What is Parkinson's? All right. Well, first of all, the mission that we have here, I created this program because I wasn't happy with what I saw out there. Now, there are a lot of really good programs. For example, well, I won't name names. There are some great programs. You've probably heard of many of them. All right. But I'm trying to make something here that is more, let's say, inclusive of looking at the brain and the body in every possible way. And of course, I didn't find anything that I feel is anywhere near complete, nor is my program as complete as I want it to be. But this program is designed with a more holistic approach to mind, body, brain, and body, so that we can fill the void and bridge the gap with education and intervention strategies to help the person with Parkinson's disease to live a better quality of life. In this first module, what is Parkinson's? We're going to learn and gain an understanding of what is Parkinson's disease. Okay, we'll also learn in another module how it might affect somebody and what we can do to help in yet another module. All right. If we look right now at that arrow, double arrow in the middle, we're going to see this. We're going to see that on the left side is the current, let's say, level of knowledge for medical care, current neurology care, physical therapy care, and the education that's out there regarding Parkinson's, what we can do about it. You know, and to some degree, there's some good stuff. And then there's a lot I feel that is lacking, or in some cases, in some areas, it's non-existent. People don't know anything. I've been flown into countries. I've been the first one to teach anything about Parkinson's. And so what we want to do, though, is take this, this entity on the left of current level of knowledge and care. We want to bridge that gap and look over onto the right side of the double arrow, fill it with education and research, intervention strategies to help improve, let's say, functional life for the person living with PD. All right. We can help. We know we can. Fitness professionals, physiotherapists, occupational therapists, caregivers, doctors, everyone can help. All right, let's move forward. There's a little disclaimer here. I'll read it to you. The methodology I teach is intended to complement medical care and medications, not to replace them. Okay, so I don't want you to have the idea that when I tell you at some point that exercise is going to probably, maybe diminish the doses that you'll need of medications, don't take less without talking to your doctor. Okay. Also, much of our education is research and evidence-based. However, there's a lot of research that needs to be done. In my clinic here, outside of Syracuse, New York, we are a research facility. We have several collaborations going on with doctors and researchers around the world. So other parts of our education are not based on research, but have proven to be highly effective. Okay, we have to think outside the box. Can't just use research-based things. We have to do our own research. And also, as we go through the program in further modules, just remember, safety is always first. For people with PD and people who are working with clients or patients, have them do what they can, but not what they can't do. Challenge them, just don't hurt them. All right? We know that people with Parkinson's describe it as a full-body multifunction experience. Well, our goal is to help them to live a full and active life, to slow disease progression, okay, and to positively impact movement and quality of life for people with Parkinson's and their caregivers. We also, for those who may be genetically predisposed to having Parkinson's or dementia, cognitive decline, Alzheimer's, and a slew of other possible neurological or movement disorders, we want to go through in further modules how we might be able to delay the disease onset or eliminate it altogether. Okay, no guarantees, but as we go through, you'll learn how we probably can delay disease onset or maybe eliminate it. All right, so for you to get the most out of this, though, it's very, very important to think about two things, okay? Well, it's kind of like one thing, and I have it in two different statements here. I want you to focus, okay? I want you to hyper focus as we go through. I want you to think about the journey versus the goal. Okay, the journey for you, I imagine, is to learn as much as you can. All right. In order to make that happen, you must hyper focus. Make the journey a rewarding process. Education is part of your journey. All right. Let's create as much brain activity as possible. We do weekend workshops, so that says this weekend. So let's do that today and throughout the program. We know that writing is good for the brain. Writing creates brain activity. So have a pen and paper ready and take notes. And this video is going to be up here so you can go back and watch over and over and over. And of course, it will be on the online platform as well. All right, so people with Parkinson's are people too. What the heck does that mean? I mean, that sounds ridiculous, doesn't it? Well, you know, sadly, I have seen so many personal trainers, physical therapists, and even neurologists and doctors who allow Parkinson's or Alzheimer's or cancer or whatever to define the person they're working with, to define the client or define the patient. You aren't Parkinson's if you have Parkinson's. You are a person who lives with it. You aren't your diagnosis, and a diagnosis does not define a person. A person with Parkinson's might have other issues too. Maybe they had cancer, hip replacement, heart surgery, heart transplant. You never know. So Parkinson's is something that a person lives with. They aren't Parkinson's, all right? Doesn't define them. Now, our education, though, while it's focused on Parkinson's, I want you to realize that whatever it is that causes you not to, let's say, move as well as you used to, if you have a diagnosis of anything listed here, okay, what caused you to get to where you are as far as, let's say, impaired movement to some degree or cognition or memory, that may vary with diagnosis or even between people with Parkinson's. You know, no two people with Parkinson's are affected identically. Okay, so what's getting you to where you're at, and let's say any challenges you're dealing with, is one thing. But our intervention strategies, you know, even though they're individualized for each person, they really apply to all people. And you'll discover why as we go through this. All right. So the short version of what I just said is this programming applies to all people. Okay. People with no diagnosis can benefit from our intervention strategies. Let's get into what is Parkinson's, because throughout this module and also throughout the whole course, okay, which is many, many, many modules, I don't even know how many, we're going to learn what is Parkinson's, who gets it, what are some of the symptoms, motor and non-motor symptoms, how does PD affect strength, movement, mobility, stability, flexibility, cognition, memory, emotions, and overall functionality. What can people with PD be doing to manage disease symptoms and reduce or eliminate falls or injuries? How can caregivers, home health aides, and others help the person with PD to improve quality of life? And as personal trainers, PTs, OTs, coaches, and doctors, what assessments and programming can we use to help people with PD to improve movement, memory, cognition, and quality of life? So that's an overview. Let's get right to the main meat of Module 1, which what is Parkinson's? Well, the clinical definition is Parkinson's disease, also known as PD, is an idiopathic progressive neurodegenerative disorder of the central nervous system. What does that mean? Idiopathic, from an unknown source. We don't know where it comes from, although we can talk about that in a minute, where we suspect it could come from. All right. Neurodegenerative disorder of the central nervous system. Well, that's, you know, central nervous systems hooked into the peripheral and other nervous systems and the brain. It's all a continuous loop, and so it's all affected. The immediate cause of PD is the degeneration of brain cells in an area known as the substantia nigra, that's housed in the midbrain inside of the basal ganglia. And this is also one of the primal movement control centers of the brain. Degeneration of these brain cells causes a reduction in the production of dopamine. Dopamine is a chemical messenger, a neurotransmitter responsible for transmitting signals between the substantia nigra and multiple brain regions. The loss of dopamine results in greater difficulty producing smooth, intentional, purposeful movements. All right, so in short, that's Parkinson's. If we look here on the image on the left, the top view, all right, we see that little butterfly shaped thing in the middle. That's the substantia nigra. All right, it's small. Now, the upper right, we see the substantia nigra with two dark lines. Well, what does that mean? Actually, that represents what a healthy substantia nigra would look like. Dopamine is dark in appearance, hence substantia nigra. Nigra is dark in Latin, I believe, and substantia is substance, so dark substance. All right, so the bottom right image shows a lighter color. All right, it's not as dark. Well, this is diminished substantia nigra dopamine production as seen in Parkinson's disease. Now you can see this diminished in other things as well, such as let's see, multiple system atrophy, I believe progressive supranuclear palsy, although I have to look that one up, and a couple of others. But Parkinson's is the most common of all those, so this is what it would look like in Parkinson's. All right, so recap quick is brain cells are dying in the substantia nigra. Those brain cells produce dopamine. Less dopamine means that there's less neurotransmitter, okay, because dopamine is a neurotransmitter. Less neurotransmitter to go from the brain through the nervous systems to tell the body what to do. You want to take a step, but you're frozen and you can't take a step, right? That's an example. Substantia nigra is dying. Control of movement is impaired. Impaired movement will get worse as the disease progresses.